her job in the economic downturn of 2009. She had always had a job before that and had run some of her own businesses before. And unfortunately for her, right at that time was also when she was diagnosed with breast cancer. She purchased Cobra to continue getting some insurance coverage even after she lost her job, and was able to get the cancer removed from the breast. And they said to her, well, we think we got all the cancer, but you never can tell for sure when you take it out. But they said, this is not a benign thing. This is a very nasty cancer, and you need to get chemotherapy and you need to get radiation. But by the time she got that far in her treatment was right when her Cobra was running out. She couldn't afford any more Cobra. That was $900 a month. Cancer came back, and now she's on hospice. She'll die within a couple of months. She's confined to her bed now, and she's gonna die without ever having gotten the treatments that she should have gotten. But that's the kind of person who, next time around, might get the right treatments because of being on Medicaid.
What is Medicaid?
Isn't that helps senior citizens? It's the health insurance they get from Social Security.
Isn't it like health plans for people? Isn't it like within this country?
Medicaid is something that is offered to the elderly.
It helps individuals that cannot, well, the elderly or the uninsured, like the babies or mothers that do not have health care.
Medicaid's the federal government's program.
Okay, for what?
For health care.
Yep.
On May 2014, Becky Larkhart, a Republican member of the Utah House of Representatives, stated in a press conference that it is best not to make an almost permanent decision on a Medicaid plan that could cost Utah taxpayers tens of millions in afternoon special session, when it would be better to consider such an important budget issue in the 2015 general session where all spending proposals can be considered in total. With this declaration, the debate on Medicaid expansion in Utah became a stalemate discussion. While a promised special session was declared, no definitive date was given, and many believe it might not even take place until late 2015. While Medicaid expansion could be better analyzed financially in a special session where its budgeting could be compared to other essential budgets, 105,000 uninsured Utahns are left waiting for an answer. The question is whether time is on their side. One of the primary concerns of expanding Medicaid is the total cost of it and whether it is even probable to accomplish. Under the Affordable Care Act, during the next 2 years, the federal government commits to paying 100% of the cost of the Medicaid expansion. But after the 2 years, it will be paying only 90% of the cost, leaving the state paying 10% of the total cost of the Medicaid expansion. What many states worry about is how they'll be able to cover those future costs, and whether the federal government is even capable of keeping its promise of covering the majority of the Medicaid expansion. And considering the overall cost of Medicaid expansion and the nation's overall debt, they're not wrong in worrying. According to the Kaiser Foundation, a nonprofit organization focused on national health issues, conducted an online screening survey on clients from ClearPoint, the partner organization of the Kaiser Foundation. They gather information on the individual's insurance status, total amount of medical bills, mortgage payments, job loss, etc. Afterwards, a total of 23 individuals were interviewed for an hour about their insurance coverage and financial status. The overall data is represented within the charts. While the survey was conducted within a small portion of the population, their circumstances are consistent with findings of other studies of medical debt that show the difficult financial struggle that many uninsured individuals undergo. Essentially, medical debt becomes not only a patient's problem but also the hospital's and government's problem as well. In total, the extensive amount of medical debt accounts not only for advising costs of premiums to those who pay for insurance, but much of the unpaid medical bills from hospitals are indirectly passed on to the average taxpayer with insurance. Expanding Medicaid may essentially reduce the unpaid hospital bills and therefore reduce the cost of premiums and also cover those who are most likely to use emergency services, which is a major source of unpaid hospital bills. The Oregon experiment conducted by Sarah Tubman and Catherine Baker involved studying the effects of Medicaid. The two scholars randomly selected individuals who had Medicaid and those who were uninsured to better test the actual benefits of Medicaid. The ending result was that those who had Medicaid were more likely to access their health services more, raise rates of diabetes detection as well as other chronic diseases, have lower rates of depression, and also produce less financial burden from out-of-pocket costs and hospital treatment. While many quickly jumped to assert that the Oregon experiment proved the benefits of Medicaid and that it showed to promote good health, those who looked at it with a more skeptic perspective believed otherwise. According to an article titled "Oregon Study, Medicaid Had No Significant Effect," states that the Oregon experiment only proved that those with Medicaid were much more likely to visit doctors, but not that Medicaid led to good health. It stated that the results were minimal to provide any significant impact on a person's overall health. Yet, because of the frequent available doctor visits, many were able to detect disease in time and were able to have the opportunity to care for their health with little to no financial burden, especially when covering preventive care measures. The Kaiser Foundation, through its collection of various experiments and sources, reaffirms the results of the Oregon experiment. They initially compared the effects of Medicaid on low-income families as opposed to low-income families that were uninsured. The overall results showed that Medicaid not only relieves medical debt, but it also shows that those with Medicaid have better mental health, more access to health services such as preventive care, better health care, and also more access to specialist doctors. While both studies don't prove that Medicaid ensures good health, it does, however, show that Medicaid does provide many the opportunity to obtain a good health as opposed to those who don't have any kind of insurance.
How many times you lived in pain? How many scars between your veins? Where were you when this was being real? How many times you missed the train? How many songs you never heard? Where were you when this was being real? I'm here to tell you this won't last forever.
People, individuals don't have insurance. That's not right. That's not justice.
It's not a political thing. Have compassion.
We can brag about our economy, we can brag about what's going on in the state, but if we're not gonna, if we have thousands of people that are dying senselessly, especially when there's an option, we've got to do better.
Medicaid helps people like me who are decent, hardworking people who don't think we're entitled to anything but life.